welcome back to the Body Pod, everyone. We are so excited. We have Dr. Kelly Casperson here. We've already done her intro, so we are so excited to just get into all of these questions that we have and any questions that you have sent in for us. So welcome, Dr. Casperson.
Thanks for having me.
Okay, first of all, we were just saying this offline, but you are so funny. And when I was watching your TED Talk, I'm like, this person, I need to live next door to Kelly because
the same. We're like, why is she not our best friend?
yes.
Thank you. Where do you guys live? Maybe we're close. Maybe we don't even know it.
Older.
I'm in Park City.
Oh, I lived in Denver for 6 years.
Oh,
See?
really?
Missed opportunity.
Well, where are you now? You're in Washington.
I'm in Washington State now.
Oh,
Yeah.
Yeah.
Well, that's
I went
pretty.
back to Denver for the first time last spring, and I was like, you guys, has it always been this brown? And they're like, yeah. And I'm like, I forgot.
Right. And it's funny because every time I drive out of state and you're just like, you're leaving colorful Colorado. I'm like,
it's
no,
not.
The rocks.
It's not. Who came up with that tagline? They need to redo that. So
Totally. My first date with my husband was in Boulder.
Oh, I love that.
elemental.
So it's special. There's two
Yes.
kids because of Boulder, Colorado, I'll have you know.
Yeah. I love it. Well, okay. So, Dr. Casperson, here we go. Let's talk about, well, first of all, your TED Talk, because I just was blown away. I've watched it multiple times. And
Thank you. I'm always like, nobody ever talks about the TED Talk.
Oh my gosh, that was the first thing we wanted to talk about.
Yeah,
talk about the TED Talk.
Why we need adult sex ed? I mean, we just had a sex therapist on, and she was like, adults need to be, they need to be teaching their kids about sex ed better. And then I'm like, we don't even know what we're talking about.
Teach them what Hollywood taught you? Like, it's a disaster.
Yeah. So can we talk about that for anyone who hasn't? Well, first of all, you need to go watch it right now. But if you haven't,
well, watch the TED Talk. Yes. If you type in TEDx Casperson, it'll on Google or it'll pop up, or on YouTube. It pops up. Yeah, I love that. That's my 12-minute baby. You would spend like a half a year working on a TED Talk. So I'm super glad I did it. The TED Talk started out, so I really started out diving into female sexual health. And so the TED Talk started out with female. It was going to be female education. And because women have way less orgasms than men do. And that's not because their body can't do it. Lesbians have same amount of orgasms as men do. You literally put a penis in the room and a woman's orgasms go down. So they did an amazing bisexuality study looking at that, which is just sweet research. But so it started out female sex ed. And then I was like, yeah, no, well, the other 50% aren't any better on this, right? So the TED Talk really did open up to all adults and being like, you won't think you're so broken if you just get some basic information.
Yeah.
Yeah. I love when you say in the podcast, when you ask the question, are you completely confident in the bedroom? And do you talk to your partner about it? I just thought that was such a profound question because all of a sudden I found myself asking myself well, am I? I feel like I am, but then it's like, right? Well, am I?
Me too.
And I think it's such a good question.
Right. And then if you're not, be like, oh my God, I've probably lived my whole life this way.
Yeah.
Or what got me not, what happened, right? If I was, which I would say is the more unique one. I think we fumble around in secrecy as teenagers, learn something good, bad, neutral from that first experience, and then we just take that forward.
Yeah.
Yeah.
Yeah. Well, I have to tell you, these are the exact words that I've spoken forever. Was like, I don't know, maybe I'm just broken. Exact words. I'm just like, I don't know what to say. And so this was really enlightening. But
that's why it was so easy to name my podcast, because when I started talking to women about sex, that's what they just kept saying. I'm broken, I'm broken, I'm broken, I'm broken. And I'm like, well, actually, most women don't have an orgasm from putting something in their vagina. You're not broken. You just don't know that fact, right? And then another woman, she had never had an orgasm. And I'm like, well, 10% of women have never had an orgasm. So it's
that
not
is a shame.
Isn't it wild?
That is
and
wild.
The sex researchers say it's not because it's rare, that it's actually because it's a body problem.
Yeah.
It's really, and you know, going back to the TED Talk of like, sex is biopsychosocial. It's not just our bodies. It's not just our hormones. It is, you know, the religion and beliefs your parents gave you and your first experience. And dude, the power differentials in heterosexual relationships. I'm telling you, nobody talks about this, and it
No.
profoundly affects people's sex lives.
Oh my gosh. Okay, let's dig into that a little bit, the biopsychosocial, because I love that, and I'm sure a lot of women are like, "Okay, that sounds cool, but let's dig into
Well,
it."
they're probably like, "This sounds really complicated," because that's how I thought. Like, I'm like, "That is a long word." So and I actually, like, I hated that word because I'm like, I think it sounds super clinical. It sounds like somebody knows something that you don't know. Like, do you have to go to like, grad school to figure out what biopsychosocial means? And as I was writing the TED Talks, you know, they're kind of formulaic, like 3 important points, blah, 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 right, for a TED Talk. And I was like, "Oh, crap. Biopsychosocial." It makes sense, and it lends itself to a nice TED Talk because then you can break down all the pieces, but basically the word just means that, like, everything's affected by what's around you and how you were raised and your body, right? Which you could also say, like, our eating styles and choices are biopsychosocial, you know? It's like, what does your body tolerate? What foods did you grow up with? What does society tell you about the foods, right? Like,
That's so true.
eating is biopsychosocial.
Mm.
So once you kind of break it down and be like, oh, right. Yeah, that's just like humans don't exist in a bubble. Your sexuality doesn't exist in a bubble. It's influenced, whether it's probably not consciously influenced, but you have been watching Hollywood movies your whole life. You have been influenced about sex roles, gender roles, who initiates, how fast people orgasm, you know, that the clitoris is non-existent, right? Like you have been influenced by that, because like what other good sex ed do we have in the United States? The data says our sex ed now is worse than it was in the 90s.
Oh, come
I
on.
can
I
see why
know.
though, because of everything that's online
That
now.
got
Yeah.
political.
Mhm.
It kind of got political. So like, but to me, I'm like, you know, I'm a victim of the 90s sex education, but I'm like, dude,
Ew.
when I think of the female body parts that I was taught, like when I think of like what was on the screen, it
Yeah.
was uterus and ovaries. Like
Uh-huh.
that's the
That is
female,
so
right? And
true.
it's like, although important body parts, not responsible for pleasure.
Yeah. Oh. So what okay, this is going off topic of where I was gonna go, but how do you think the kids growing up now with the porn industry, let alone Hollywood, but that are just like coming into this and they're just like, "Oh, this is gonna be the sexual experience. This is amazing." And
Yeah.
then you're like, no."
So there's a profound disappointment between their reality and what they've been watching. So, I mean, porn used to be like so rare. You had to like go over to your friend's house, sneak into their dad's
Yeah.
closet and find the magazines that were in the brown paper bag. Like legit, because that was like my first experience with like male gay porn in 7th grade at my friend's house. So, like, it was, like, very hard to access. Now it's I mean, it's in your pocket all the time,
Yep.
right? So, like, porn has profoundly influenced people's perception of not only what women want, but how men are supposed to perform. And so now that, you know, talking to my friends who do the sex ed in colleges and stuff and the health centers, guys coming in thinking their bodies are profoundly broken because they don't last 2 hours, or they think they, you know, ejaculated too soon, and then they're coming in super confused because they're like, I don't think the women are liking what we're doing because what we're watching, right? So like it's a profound disconnect. And part of sex education is that a lot of audiovisual is performative. This is a movie. Right? I
Yeah.
love the analogy. This is not mine, but it's like learning to drive by watching the Fast and the Furious franchise
Yes.
It's such a good
of like
analogy.
not reality, but we know that,
Mhm.
right? We don't know that with sex ed because we never got a good sex ed to be like, oh, these people are faking it.
Yeah. Oh,
That's so
so
true.
do you see more male or female clients, or is it just pretty much a mix?
I see about 70% female, but I mean, I still see a lot of guys. What's been very interesting because I've really deep dove into caring about the female now in the last 5 years is when a guy comes in for erectile dysfunction and, Viagra prescription, whatever, we talk about their health because, again, penises are biopsychosocial. Like, if the heart health that you have is not good, the penis doesn't function, right? We never talk about erectile dysfunction. But so they're coming in for that. We're talking about their heart, like, all these things. And I'm like, what's your plan with this? I thought these guys would have a plan. like profoundly interesting that like 9 out of 10 are like, I don't know. I was just going to, go home and maybe have sex with my wife. And I'm like, okay, so you haven't had sex in 5 years. Does she know you're here? Does she consent to you coming home with a super dick? Like, have you had this conversation?
Yeah.
And they're like, 10 times out of 10, they're like, no, haven't had this conversation. Which is enlightening on like, dude, people don't talk about their sex lives. They've lived together for decades and do not talk about their sex life. I got to tell you, things get so much better when you start talking about it. And nobody's died so far. I've never read a report of somebody dying from talking to their partner about sex.
That's so true. It's the lack of communication. But speaking of the ED, that was a statistic that you shared, I think on Instagram, that 40% of
Oh yeah,
men
that was on
by
a TED Talk.
was that on the TED Talk?
Yeah, that was on a
40%
TED
of
Talk.
men, 40% of men by the age of 40 have erectile dysfunction. Is that correct?
Yeah, at least a little bit.
Which that's
What?
But to me, I'm like, if I was a man, I would want to know that because I love how you talk about the shaming and the shoulding. Because I think I would feel that as a man, because obviously we have, as women, our own set of shame and shoulding. But that's a pretty powerful piece of information.
Yeah, I mean, I think it really normalizes that our bodies age. I think it normalizes that, like, what you choose to do with your health, whether it be drinking, smoking. By the way, drinking's horrific for erections,
Oh,
but yeah, and exercise. But like that is profound. Like, I've got guys in their 80s who have perfectly fine erections. It does not mean everybody's going to have problems. But I think it's, when women enter perimenopause, menopause, and we start needing lubrication. By the way, we should just start lubrication at like age 18, but
Yeah.
lubrication, vaginal estrogen, all the things is like normalizing it of like, dude, guys have changes in their bodies too, right? Like none of us are immune from the powers of aging, and it's okay to do something about it and get it treated.
Okay. I'm so happy because I always feel like we get the shit. Like, the babies, menopause, men can go after like younger girls, like we're aging up I mean, it's literally like I didn't even think that that many men had to struggle with it. And of course they're not as comfortable talking about it.
no.
But
Wow.
yeah, I just read this one study about like the actual amount of erectile dysfunction compared to like how many people actually go to the doctor about it, right? And Viagra is over the counter in a lot of countries. So, like, in a lot of countries, guys don't have to go. And now we have all these online pharmacies. So we're really opening access to people, kind of reducing the challenge that it is to go see a doctor. But yeah, it's super common for them. And, the erections, guys really tie erections to the definition of manlyhood, the definition of a man, that you're fully capable, that you can, but again, going back to the sex ed, like good sex ed will tell you it's okay to lose an erection in the middle of sexual activity. It's normal and it happens and it doesn't mean you're broken. But guys don't know that. And then they watch the movies and these guys are like obviously enhanced many times and taking performance enhancing medications, right? So they don't know that.
Yeah.
And it's like erections are not reliable, but a good sex ed will teach you that. And people don't know that, so they just feel profoundly broken, ashamed, less like a man. And the more anxious and stressed you are about your erection, the more you're going to not sustain an erection, because when the body's stressed, erections are like, now's not the time. He's stressed, right? So it
Yeah.
actually can compound and make it worse.
Yeah, performance
Well,
anxiety, I'm sure.
yeah,
Totally. Yeah, performance
definitely.
anxiety.
I have to say the vaginal dryness, which you had the best podcast on that, the menopause symptom no one talks about. I mean, come on. So let's move on to the
Yeah.
vaginal dryness. And calling it when you said the vulva vaginal atrophy, I'm like, nobody wants that at
No,
all.
but it
No,
gets worse, my friend. In the 80s, it was called the senile vagina.
stop it.
Stop right now.
So it
This
keeps,
is
at least it
scary.
keeps kind of getting
Oh,
better. I don't know. But yeah,
Oh,
because people are like, nobody likes vaginal atrophy, so we call it GSM, or genital urinary syndrome of menopause, right? Which is a mouthful, but it's a better term.
yeah.
And I'm like, well, nobody liked vulvovaginal atrophy. That was an improvement from senile vagina.
Terrible.
so bad.
Terrible. I was pulling, the reason I know this is I was pulling up my guy at the medical library was helping me. I was pulling up an old study. Actually, I had to like take it off of a shelf and Xerox it for me. And it was the study from which the use it or lose it myth comes from. Because I'm like, where does this come from? Let's go back and dig and find the thing that like everybody kind of cites. And in it, they talk about senile vaginas. And I was like, oh, that was a gem I hadn't planned on discovering.
Oh my gosh.
Yeah, but getting back to like people don't know. Like it goes back to education again. Like people think menopause is a hot flash. Menopause is not a hot flash. And menopause is when you can no longer get pregnant, but that's not what it is. Those are just like signs and consequences of what it is. And
Yeah.
what it is a profound hormone change. Another way of saying that is a profound endocrinology change, right? Like you are outliving your ovaries, which is a whole nother podcast of like, if you outlive your eyes, you get glasses. If you outlive your hips, you get a hip replacement. If you outlive your teeth, you get teeth. Why are we so afraid of replacing what our ovaries we're outliving, right? But so with that, your hormones go down, including testosterone, and the pelvis is profoundly active and lovely and healthy because of your hormones. So when your hormones go down, your labia can disappear. Inner labia disappears. Nobody knows that. You can get more recurrent urinary tract infections, pain with sex, more yeast infections, more burning when you pee, getting up at night more to pee, frequency, urgency. All of those things are under the umbrella of genital urinary syndrome of menopause, or GSM, and explains that both the genitals and the urinary system change because of menopause. Now, 2 more things and then I'll stop talking. This can happen before your periods are done because your hormones start fluctuating before your period. So people are like, my doctor said I was too young because I was 42. Like, no, your estrogen can go low. Certainly your testosterone is low often by that age. And you can I saw a woman, she was in her mid 40s, profound vaginal atrophy. And what this means is you can't penetrate, tampons are painful, it burns when you pee. This is not just sex. For the people who think sex is extra, I would say it's an important quality of life piece. But can happen certainly before menopause. And for a lot of people, it happens 8 years after menopause. So they come into my office and they're like, but menopause was years ago. And I'm like, well, yeah, but you still have low hormones and now it's caught up to you in that department. But because we don't have any education about what menopause is, people disconnect that what's going on in their pelvis is because of a change in hormones.
So is the best way to correct that or help is through hormones?
100%. Now, the medical literature will say try non-hormonal treatments first. What that means is lubricants and moisturizers. Lubricants and moisturizers are Band-Aids. They make skin feel better, but it doesn't actually, like you could put on glasses or you can just print everything in 20-point font, right?
Yeah.
And you're like, well, glasses actually like just make it all better, right? I think, this is my opinion after being into this for a while, is I think vaginal estrogen, other people call it local estrogen or pelvic estrogen. If you're on Instagram, you don't want to say vagina too much because they'll kick you off. And it's true. So I call it pelvic or local estrogen.
Okay.
That's just like skincare. It's skincare for down there. And I think at a certain age, women should because what do you want to do? Do you want to come in to see me once your labia are gone, you don't want to have sex anymore, and you're on your 4th urinary tract infection?
No.
Perfectly reasonable if you want to wait for that. Or you could be like, how can I just like have good skincare so I don't have that happen?
Oh my
It's like,
gosh.
Do you want to come in once your face is
Skincare
skin
for the
damaged, or do you want to wear
badge. I'm
sunscreen?
obsessed.
What's that?
I'm obsessed.
Skincare for the badge. I'm
Yeah.
obsessed.
Dude, skincare is like a $26 billion industry.
Yeah.
Like, women care profoundly about their skincare, and this is just vulvar, vaginal, bladder. It's genital urinary skincare. Very safe, incredibly safe. So safe, it's over the counter in multiple countries. So safe that breast cancer survivors can take it. So safe that breast cancer patients who are currently treating their breast cancer can take it. Vaginal estrogen just is in the pelvis. It won't prevent your bones, right? It won't prevent osteoporosis. It won't protect your brain. It won't protect your heart, like all the amazing things that systemic estrogen will do.
Right.
All it does is help GSM. And my argument is it should be a preventative medicine. Like age 55, pick a number. Like, here's your mammogram, here's your colonoscopy, here's your vaginal estrogen.
Okay. You need to be everyone's doctor.
I know.
So
like, I feel like I
care about
already
this
need
topic
the vaginal
profoundly. Don't
estrogen.
ask me about anybody's ear problems. I cannot help.
yeah. Well, okay. So I always like throw myself under the bus on every podcast. I'm like, well, here's my problem.
I know both of us are like dragging
know
our.
I hate
Aren't podcasts just created for the host to like help themselves? I mean, come on. That's what we're all doing.
So, okay. The overactive bladder. I did not know that was a symptom of perimenopause. And let me tell you, I've gone to the urologist and he had me on the what are the
the anticholinergics. Those are nasty drugs.
Yes.
By the way.
I'm so annoyed. I was on it for like 3 years, and then my new urologist, because this guy like bounced, he was like, "Oh no, you can't be on that. Like, you don't go on that long term." And I had no idea. So now I'm like, well, why am I peeing all the time?
Freaking vaginal estrogen. What's wrong with your urologist? I'm allowed to say that because I'm a urologist.
Yes, exactly.
And I'm also allowed to say that because I was literally in Denver, Colorado last spring looking at how brown it was, telling the Rocky Mountain Urologic Society that vaginal estrogen is equivalent to anticholinergics. Like, we literally have that published data. The problem with that data is it's hiding in the menopause journal, and urologists besides me don't read that. But I was literally in Denver last year telling the Colorado urologist that vaginal estrogen is equivalent to the nasty medications they put you on.
He's fired. He is.
Plus, dude, I have an amazing urologist near Boulder who's a female that you can go see. Her name is Dr. Carolyn Franziak. Go see her. She's amazing.
Tell her
I said
hi. I'm seeing her as soon as I get off this call. This is like that information.
Help me help you.
So overactive bladder and incontinence, is that?
Yeah, incontinence just means bladder leakage.
Okay, that's what I wanted to know the difference. So many women always complain about if they sneeze, if they jog, they're running, they're anything that your pee just comes out. So
let's talk about that because that's super important and very common. So leaking when you cough, sneeze, laugh, trampoline, double under, exercise, right? It's called stress incontinence. People think that means it's because you're stressed. It's not because you're stressed. Stress means a force. So it's a force on the bladder, force on the pelvis, right? So running, jumping, coughing, sneezing, all of that will push urine out of the pelvis. Happens with aging, decreased collagen, decreased hormones, decreased muscle strength, also putting any sort of baby through a vagina once or multiple times can increase. So there's many reasons that it happens. Vaginal estrogen may or may not help. Doesn't help everybody with that.
Okay.
I've seen some women on systemic testosterone get helped with that. I'm not saying that's why we should use systemic testosterone. It's another podcast episode. But sometimes systemic hormones do help. Pelvic floor physical therapy can help greatly. They're awesome. And the traditional surgery was a sling. It's called a midurethral sling. It's been around for 20 years. I've done plenty of them. It's a great surgery, but I'm giving you a 3% risk of mesh complications for your life because I'm putting a permanent piece of mesh in there. I will now offer you the best new thing since sliced bread, which I went in very skeptical and cynical because I'm not the youngest urologist anymore. It's called Bulkamid, Bulkmid. You know how women get fillers for their face?
Yes.
To make their cheeks and their lips more full? It's filler for your urethra.
Oh my gosh. And
it decreases stress incontinence by like 50 to 80%. It's a 3-minute procedure. There's no downtime. I'm like a walking billboard.
This is phenomenal.
It's like you can exercise the next day. You can have sex the next. If you have a sling, you can't have, put anything in your vagina for 6 weeks and you can't exercise. Like downtime's a big deal for busy women. Bulkamid, no downtime. Just the day you're having the procedure. I have you pee before you leave my surgery center because I want to make sure you're not, haven't blocked. And it's not permanent like a mesh sling is, but the benefit is you don't have any risks of things being permanent in your body. And so you just call me and you just tell me when it wears off and we give you more. Insurance covers it.
This is a no-brainer.
It's a no-brainer. Nobody knows about Bulkamid yet. It's been in Europe for over 7 years. It's been in America for about 2 to 3 years. I'm telling you, believe me, I went in cynical. I'm like, slings are pretty awesome. Why am I going to do something that's not maybe doesn't let, like I went in with a scientist mind. I'm like, I don't know about this. If women tell me they don't like it, I'm not going to do it. Like that's how I went in. And now I'm like, these are the happiest freaking women. They like bring me houseplants as thank you gifts.
I love it.
One woman came in with no underwear on just to show me she can wear no underwear now. She doesn't leak it off.
I love it.
Like these are happy women because it like is hardly a surgery.
And
I give you a little IV anesthesia because if you're going to put a needle in my urethra, I'd like a little IV anesthesia, but like no breathing tube, no incisions, no stitches. Like this is filler for your urethra for stress incontinence and insurance covers it.
I can't take it. And I feel like women don't care about going and getting something done again because they're used to getting the Botox or getting, you go and get your teeth cleaned. How often? I don't know. I just feel like that's.
I agree. When I was starting to do this procedure, I had a woman come back at a year. She's like, yep, wore off. And I'm like, listen, let me ask you, would you rather come back and see me once a year for this, or would you rather me give you a sling? Right.
Yeah.
And she's like, this once a year, hands down, keep the mesh out of my body. And I'm like, the women are speaking, man. They know what they want. Mm-hmm. We've got options. They know they want the Bulkamid. Oh it's very rare that I see a woman and do a sling now. It's usually like do a Bulkamid. If it didn't meet your expectations, let's do it again. Mm-hmm. So you get 2 Bulkamids before you've bought yourself a sling. And I've probably done 200 to 250 Bulkamid in the last like 2.5 years. And I've put slings in 4 of those people.
It's a great outcome.
This is amazing. And so it doesn't always come down to like not having a strong pelvic floor.
Not always. No, the control of urine is actually quite complicated, right? So it's like the integrity of your urethra, so integrity of the urethra, collagen and hormones, right? Estrogen really helps the mucosa, the collagen, the blood flow, just keeps things plump so it doesn't atrophy. So estrogen, hormones, also the descent of the urethra where it rides underneath your pubic bone. It can get pushed down a little bit by having a baby, age, all that stuff. And then the muscles of the pelvic floor. So it's not just, I agree with the pelvic floor physical therapists. Try it. It's non-invasive. They can help. It makes a world of difference. But if it helped everybody, I would be out of a job in that department. And I'm telling you, I'm not.
Yeah. Do you do vaginal reconstruction surgery?
Yeah. For prolapse? Yeah.
Yeah. Or just anything. If a woman comes and
I cringe. I get I'm a protective person. I get very protective of my women and I get very cringy anytime people are like tightening, rejuvenation, like those words mean nothing. And you're playing on the insecurities of women because they don't know if their vulva and vagina is normal. And like, I think there's a huge market for preying on women's insecurities about their genitals. So I do nothing like that.
Yeah.
For me, it's like, dude, I had a baby. I haven't been on my hormones. This tennis ball's falling out and I can't exercise. I'm like, fix it if you want to fix it. Absolutely. So I do a lot of pelvic surgeries, a lot of vaginal surgeries. But anybody who's got a website about rejuvenation and tightening, what the fuck is tightening?
Okay, well, to
me, I'm like, dude, people come to see me because sex is painful because it's too tight because they don't have estrogen. So to me, I'm like, anybody who's branding vaginal tightening is I don't know, a predator.
Okay, well, we read how you said there are
Can you
3
expand
things
on that?
I know 3 things that you should never do, and I have done 2 of them.
Yeah, the PRP, the vaginal tightness, and the overactive bladder, which I've done that.
Oh,
So,
yeah,
I
and you
guess
did
we've
that
covered
pretty
all
good.
of them.
Yeah.
Oh, the anticholinergics for overactive bladder.
Yeah. So
I
between
know.
Haley and I, we have covered them all, but her and I both have done PRP in the clitoris. Can you please tell us why we shouldn't do either of
You
those?
just outed me out on
Listen,
the podcast.
if women want to spend their women can spend their money however they want to spend their money. Like,
Yeah.
I'm not here to tell people not to. They can bedazzle their armpits on for as much as I care.
Yeah.
But where I have a problem is when women are sold something
Mhm.
Oh, yes.
for something that doesn't either solve their problem, right?
Yep.
That's my big issue.
Yeah.
Of like, take sexual desire, for example. Sexual desire is quite complicated. It's biopsychosocial. There's a great TED talk on it. But it's like desire is complex,
Mhm.
Yeah.
right?
Mhm.
Like it's your relationship, it's how you view your body image, it's your hormones, it's how good the sex is to begin with. Like desire is really complex.
Yeah.
And when a woman is sold like, come get these proprietary injections to improve desire, I know that's bullshit
Yeah.
because it will
Mhm.
not affect everybody's desire because desire is complex,
Yeah.
right? So, and by the way, it's thousands of dollars. Insurance doesn't cover it, and you have to keep doing it if it does work.
Yeah.
So,
Well,
like,
this
even
was
for a woman who's like, it worked great, it's like, okay, well, just wait for it. Like, have you budgeted for this plan? Right? Like,
totally.
I always joke, like, women shouldn't have to remortgage their house to take care of their health.
No.
Yeah.
That's such a good point, though, about the desire. It is like we're missing that point. And in your TED Talk, I feel like one of the most important things you said too is your biggest sex organ is your brain. And isn't that what you said? I want to
Mhm.
repeat it correctly. And I just
Yeah.
think how you're exactly right.
Totally. I mean, if I think my body's a disaster, it's failed me. I'm worried about leaking. I'm checking in on my thighs all the time. Like my experience of my sexual life is going to be very different
Mhm.
Mhm.
than if I came in being like, this is what I'm showing up with today and let's try to have a good time.
Yeah.
Which is even different than fuck yeah, look at me.
Yeah.
This is awesome. I am hot.
Okay.
Right?
This
Cuz I think we're always trying to get to neutral.
Yeah.
Yeah.
And it's like, what if we were profoundly radical and tried to get to freaking awesome?
I'm obsessed
There's a
with you.
book on that.
Can
There's
you
a book
even,
called
like this
Huh?
is our best podcast already. I'm hands down.
For people who are interested in that work to get like there's this book called The Body Is Not an Apology by I think Sonia Renee Taylor, if I'm getting it right. It's like over on my bookshelf. But
Okay.
she's like, why the hell are we striving for neutral?
So good.
And it's like as soon as she says, you're like, oh right, we've put the bar real low.
Yeah. Yeah. Well, okay. This is like, since I'm sharing everything, like when I see these things advertised, you're right. Like I go down and look and I'm like, I don't know if I'm normal. Like, how do you know?
No,
It's not like
because your
you're
body
staring
parts have
at
been
me, right?
banned on the internet.
Mhm.
Like the only body parts we see are photoshopped
Mhm.
or video shopped or surgically augmented.
Mhm.
It's very hard for people to go and to see if like, how does my chin compare? Like you can go see a whole bunch of different chins,
Yeah.
right?
Yeah.
But like it's profoundly important to know that people sit within the bell curve. And if they don't, that, we can do something about it. And even if you don't sit within the bell curve, you can have an amazing sex life anyways, if it's not, a broken thing. I saw this woman, older woman. She came in with I think he was her husband. We were doing a pelvic exam for, like, I don't even remember what it was for. And she was like, I'm so sorry. I'm so sorry. I'm so ashamed. And I'm like, oh, tell me about that. And she's like, my earlier husband, like before husband, had told her that she had a profoundly abnormal labia and vulva. And but I think it was a little more derogatory of a
Mhm.
term. I made it medical,
Yeah.
but like derogatory term about how horrific her external genitalia were. And I was like, listen, I'm going to do you a favor. I look at like 15 vulvas a day. I have a lot of vulva knowledge in my brain. I'm just going to tell you where you are on the bell curve.
Yeah.
And she's like, okay. Like I wanted to keep it like super neutral. I'm like, I'm just going to tell you how average you are. I did her exam and I'm like, you're like so average, you're unforgettable. Like I can't actually remember her vulva now, right?
Yeah.
I'm like, you're just like average, normal, bell curve, nothing remarkable. And her husband looked at her and he's like, see, honey, I told you.
Oh.
And I'm like, you get to release this asshole from your brain now.
Mm-hmm.
But again, going back to sex ed, like she took that one guy's advice. How many vulvas had that guy looked at, right?
Yeah.
And taken him as what her body was.
That is so sad.
Anyways, I don't remember the point of that story, but like women are hiding in shame because they don't know if they're normal or not. That's the point.
Yes.
That's the point.
Well, all of, we're at this age where when we are with our friends, we end up talking about all of these different things. And a lot of my friends have said that they feel like their vagina has aged, like it's not looking the same and sometimes functioning the same. And they do want it to function like it did, but also look younger. And I never even thought about that until I started having conversations about it and I'm at an older age. But what do you think is the best advice for people that feel that way?
Yeah. So, I mean, again, this whole thing is biopsychosocial, right?
Yeah.
It's like, why do you want to change a body part? Oh, because society
Mhm.
told you younger is better. Okay, interesting. So there might not actually be anything wrong with the body part.
Mhm.
You're just succumbing to. And by the way, we wear clothes like 99% of the time. Like society's literally not. I understand the face so much more because it's your billboard, right?
Yeah.
But it's like, dude, literally, maybe a couple of people are looking at your vulva, and ideally, they're having a hell of a good time with it, and not trying to judge your anatomical age by it.
Yeah.
Right?
So
But like
true.
that's why I love these conversations because like you just take somebody's concern and you just freaking blow it out of the water by being like, is anybody asking how old you are? And you're like, hold on, let me check my vulva.
Yeah. And what's funny is we'll say, well, did your husband seeming like are there any complaints? It's like, no, he'd be all over it every day.
Yeah. So I'm like, okay, this is my advice. Number one, nothing prevents us from aging except for death.
Yeah. So true.
Nothing is stopping the clock. And you spend your whole life wishing you were a different age or your body looked different. On your deathbed, you kind of wish you didn't do that. Like enjoy the time you had.
Yeah.
Right. But number two, save your money. Go get yourself some phenomenal, good hormone healthcare.
Mm-hmm.
Because I would agree, our vulvas do change with age. We lose volume, we lose elasticity, and a $20 bottle of vaginal estrogen does a world of difference. And we should be putting it on our clitoris. We should be putting it on our labia minora. And that 6 o'clock entrance to the vagina is nasty. It gets tight. And that's the first part that starts hurting when people start complaining of dryness or pain with sex. So when I see people being like, get tighter, I'm like, dude, just give yourself 5 years with no hormones and you'll be tight to the point that you hate sex.
Yeah.
So like, I don't think that tightness should be a branding thing at all. It makes no sense to me. If you want to work on tightness, like get a good pelvic floor physical therapist, get your muscles toned, right?
Yeah.
So pelvic floor physical therapy and then vaginal estrogen, but don't remortgage the house or go out to dinner or go on vacation with the amount of money that people are taking from women, preying on their insecurity that their vulva doesn't look 20. Like your partner doesn't care. They probably just want more sex.
Yes.
So
what are we trying? But when all you see online is like the plastic surgery images of this is how I can change a vulva, you start thinking that's necessary. It is completely not necessary to a great sex life.
So true.
Spend your money on good vibrators for sure.
That's what I thought you were going to say when you said hormones, spend it on hormones. I was like, we're having the vibrator conversation.
Have some vibrator conversation. No, invest in some good vibrators. Like a $20 vibrator is kind of a piece of crap.
Yeah.
In my opinion.
This is the best. Okay, the pelvic floor physical therapist. I went because I had a lot of issues with my third child birth. I didn't know what that entailed, and when I went in there, I was like, "Well, that was an experience."
It gets personal.
Yes.
And for people, I want to address that, right? Because I see a lot of women say, "I don't want to go because I'm worried about an internal exam," stuff like that. And I'm like, you need to communicate that to them. You need to tell them your boundaries, whether you've had a history of trauma. You don't have to tell them the details.
Yeah.
But I fully respect if a woman is not ready to get naked and have some fingers in her for, checking out her hip joint on the first date. I get it.
Yeah.
And physical therapists can do a lot without going inside of you.
Mhm.
They're very talented people. They're better than doctors are at assessing pelvic floor muscles, and inside the vagina is the way to do that. But they can do a lot without doing that. And you can also get to know them. Is this a good fit? Are we aligned in what the plan is? Do I feel good showing up here? Right? Like, you don't have to rush into the internal exam, but you got to communicate it. You can't be like, well, here I go. And then be like, I wish we didn't do that. Like, address that, bring that up on the front end would be my advice.
That's good advice.
Oh, I just didn't know what I was getting into.
Yeah.
I mean, like, the lady was amazing, but I was just like, she's like, "Okay, so this is what's happening." And I was like, "Oh, well, I thought I was coming in here for a hamstring tightness or something. Where are we
No.
going with this?"
They learn a lot, but they're incredibly talented. There is like not a pelvic floor physical therapist that I haven't liked yet. They're invaluable. People, I mean, it's so silly, our healthcare system, right? Like, I'm a surgeon.
Mhm.
People come to me, first of all, not wanting surgery. And then I'm
Yeah.
like, I'm a surgeon? And they're like, no, I didn't know that. And I'm like, okay, well, Google. But but I'm like, you can go to physical therapy first. The surgeon doesn't have to be your first stop, right?
Yeah.
And so many good pelvic floor physical therapists will tell you, though, they'll be like, go see a doctor, get on vaginal estrogen. Like, they know the importance of hormones in pelvic health. So it's all just kind of like a mutual love fest that, like, we love them, they love us, because we all do a different part to help a woman.
So besides the estrogen, what is another essential hormone that you feel like is really helpful for women? Testosterone and progesterone?
Yeah, so there's three. I mean, there's three hormones that we can buy, right? Like, that we have pharmacy that we've created. Our bodies, well, I mean, besides the other hormones of like insulin, thyroid, all those things. But we're talking like perimenopause, menopause hormones. And to call these sex hormones is a complete misnomer. Like, yes, our gonads make most of them, but like, they work in your brain, they work in your heart, they help with insulin resistance. Like, the fact that we've labeled them sex hormones is actually like a dismissal of their importance. They're vitally important for our entire body. But again, we didn't get taught that. But so we have many hormones within there's many types of estrogen, there's several types of androgens, like all of these different things. But we have three that like money can buy. Money can buy testosterone, progesterone, estrogen. Our ovaries make testosterone, which then gets converted into estrogen. So it's actually wrong to say ovaries make estrogen, because you're missing out the fact that like we actually have more testosterone in our bodies than estrogen, because we make testosterone to make some estrogen, which is, I didn't even get taught that in medical school. Like, it's insulting how little we know about our bodies. But so to me, in perimenopause and menopause, those are the three options on the table. And I think they're all important and they all do different things. And if you see somebody for hormones and they don't talk about all three of those things, then I wouldn't say they're comprehensive. If they're only, I like put this on Instagram the other day. I'm like, if your only option for a woman is a pellet of one type, you're a one-trick pony. You're not actually a hormone expert.
I loved when you said that.
I loved when you said the pharmacists are assholes, quote unquote. I was like, yeah. So let's talk about that. The testosterone and the lack of, how hard it is to get from insurance.
It's embarrassing. And the reason why it's embarrassing is because I know, I trust, and I believe that in the future it's going to be better. Like, I know that. I know there is a world where we have good access to this. And so I'm like, oh my God, I'm part of the generation where it's embarrassing. Like,
Yeah.
but like, we have to help get it there, right?
Yeah.
So ovaries make testosterone. All people have testosterone. Men just have more of it. Right? Like, people need to know that, because otherwise I come in looking like this crazy person who's like, testosterone for women, and they're like, ah, right? So you got to like go back to the education first. But the FDA has about 20 different products for testosterone for men. We have 0 for women. The FDA has said we want 5 more years of safety data for testosterone for women, more safety data than we have for men. The additional problem, because of the Olympic doping scandals of the 70s and 80s, our legislature got a little pissed that people were doping. So they put in a federal act that all of these synthetic androgens are now banned substances, and on that list was one naturally occurring hormone called testosterone. People do not overdose on testosterone. Like, they do not do it. They might have grow some more hair and get angry. Like, there's side effects, but like, too much testosterone doesn't kill a person. But it's on this list of banned substances, including fentanyl and oxycodone. What that does is it prevents access, because now we've labeled it as unsafe instead of something your body naturally makes. Right? So we've got 2 problems. We do not have a female dosed product approved by the FDA. That means insurance won't cover it, and you have to dose it appropriately, and it's actually difficult to do. The other problem is now it's on a DEA list. Your name goes on a register of being somebody who has a controlled substance.
Stop it.
No,
What?
legit. Yeah, California has its own list, because they want to know everybody who's taken oxycodone and fentanyl, and testosterone's on that list. And you have to see a doctor every 6 months for your prescription instead of every year, because it's on that list. And it also carries the stigma of doctors being like, that's unsafe. That's a steroid. Of like, of course it's a steroid. But so is cholesterol. Like, something being a steroid means nothing. So yeah, we've got a lot of barriers to testosterone. But let me tell you, there is nothing like testosterone appropriately dosed in a woman in midlife, where she comes back to see me and she says, I'm back.
Oh, I just got the chills.
I feel more like myself. And I'm like, at the end of the day, if my job as a doctor isn't to make you feel more like yourself, what are we doing? You know, like, there is something profoundly better about women when they are on testosterone. They come back and they're like, I can think faster. I'm quicker. I have more energy. I can recover better from the gym. I just had a woman, she's like, I'm more interested in the world again. You're never going to get an FDA approval for something that makes you more interested in the world, right? Like, it's these stories that come back. The other bullshit about testosterone for women is that the main global consensus on it is for low desire. Why is the only legitimate reason for you to be on a hormone for you to sleep with somebody else?
Good point.
All messed up.
It's
So messed up. I didn't
backwards.
even think about that. Like, my male brother pointed that out to me. He's like, Kelly, isn't it kind of weird that like the only reason for women to take testosterone is to like sleep with dudes? And I'm like, yes, bro. Yes, bro.
Absolutely.
Thanks for pointing that out to me.
Gosh. And I don't want to be on anyone's list, any government or FDA list.
You are if you
That
take
sounds like a
testosterone.
murder, like America's Most Wanted.
It makes it sound like you're doing
Nonsense.
something dangerous. And so in a woman's body, the testosterone she has in her 20s is about 40 to 50% higher than the testosterone she has in her 40s.
Wow.
Testosterone starts going down much early. We kind of think of menopause as like, and on Tuesday, the ovaries stopped and then everything fell off a cliff, right? That's not how it works. For testosterone, it's a very much slower decline, but it starts earlier, but you're still going to make some testosterone even after the periods are done, right? So testosterone's kind of like slow but early, but you can keep making some. Estrogen is like in perimenopause, it's like up, down, super up, way down, up, down. Here's a period. Now you're not going to have one for a while. So estrogen is like spastic, right? And then progesterone can it's kind of doing its own thing. Nobody's really paid it. It's like the stepbrother that like doesn't come out of its room much. Like we haven't really looked at progesterone very much. But progesterone is profoundly important for mood and sleep. I think we need more research, especially in perimenopause. But so to say for a woman she's perimenopause, she still has her periods, maybe her energy's low, maybe her sexual desire is low. To me, I'm like, I'm checking that woman's testosterone way before I'm telling her to go get PRP in her clitoris or lasers or, anything else. Is like, there's things happening in your body. Let's optimize them. And by the way, it's pretty damn cheap. So, but I mean, it all comes back to education. The more we know, the less we're going to fall victim to people who just want to make money off of us.
Yeah. Okay. So with testosterone, when it's low for certain women, I just had a conversation about this week. That can affect your ability to grow muscle.
Yes.
So I have some clients. I mean, I only work with people 40 plus, and most of them are in their 50s and they're postmenopausal. And when they, again, different conversation, but when they come in, they're like, well, I don't want to get bulky. And I'm like, do you know how hard?
You're like, try.
Yeah. I'm like, do you know how many women that like, we'll talk to them when they're passed out on the floor just because they're trying to maintain their muscle that they have.
Dude, and the role of muscle in longevity, the role of muscle in insulin resistance, the role of muscle in bone health, the role of muscle in preventing falls. Like, I'm telling you, if you want to do anything to help out your 72-year-old future self, lift the weights.
Please.
Preaching to the choir. But it's like, dude, muscles are so important. Yeah, I just saw a lady, she was 60. She just came back 4 months. So sometimes taking testosterone, especially when it's appropriately dosed, and we can go into that, but she's about 4 months in, she's like, I'm noticing now my lean body mass, right? But in appropriately dosed hormones, like it's going to get you there slowly. Yeah. Not like 4 months is slow, right? Yeah. She spent 10 years without the damn stuff.
Yeah.
But, to be like, I think testosterone's important in wound healing. Yeah. Right. Orthopedic is looking like the orthopedic world is looking at, they did a study where they gave dudes super high testosterone, like way more than standard replacement before hip replacements. And they actually did better.
No way.
I know, I was a little unorthodox, but like people are, I think we are because of the stigma and all the other things that we're calling these things sex hormones. We're under researching the role of hormones in healing and lean body mass. Certainly, we know how important it is for bone protection. And in women, your bone loss starts before your periods end. Everybody's like, oh, that happens after your periods end. It's like, no, this starts before. Because remember, the hormones are already doing their thing before the periods stop. It's profoundly important.
I'm getting blood work done.
I can't even with this conversation. I'm giving you a standing ovation.
I know.
I don't want it to end. I'm super sensitive of your time and our hour is up. But holy, like my brain is just running with all of these conversations that, I mean, I love what you're doing, Kelly. I love your personality, number one. Yeah, I mean, that alone, outside of all of the education and knowledge that you're sharing, but like, it's just on the opposite side. To wrap up, like I see women all the time that are just like shamed about weight or the fact that they don't have as much lean body mass and all of these things. And I'm just like, why are we making our lives miserable when it's just hard? I mean, and a lot of that comes from biopsychosocial. And it's just, it makes me so sad when women are just like kind of told that after midlife, like, well, why do you care that much about your body or about your sex or about, anything? It's just, it's very disheartening.
And, I've thought about this. These are things I think about a lot. But so, we're like, oh, society tells women all these things. And it's like, we just lay down and fucking accept that. And it's like, No, you get to decide. You control the narrative. You tell people how to treat you. You tell people what the women are like at this age. Like I'm so sick of this like laying down and taking it attitude of like, do you not realize your power? We have immense power. Freaking use it.
Yes. Amen to that. And I think the older we get, the better we get. I don't think it's the
Oh my
opposite.
God. Yeah. I mean, you just look, I'm so inspired by the thing of like, Martha Stewart didn't make her first million, and I'm making this up because I haven't looked recently. But like women kick it into gear in midlife.
It's true.
For any woman to be like, oh, they told me that this is just blah, blah, blah. It's like, no. This is when you can kick it into gear if that's what you want to do.
Yeah.
You don't have to do that, right?
Yeah.
But it's like you write the narrative because we have the immense privilege of living long. And we've never lived this long before on a global scale. We are literally making it up what aging looks like. And all this is just a big grand experiment for the next generation, right? We're trying to help out our kids.
Yeah.
So
what you are doing with
I
the
think
sex
it's an amazing moment right now in midlife for women. And I'm like so happy to be part of the conversation.
Me too.
Yes. That is the perfect way to end. Really quick. Can people see you online? Do you do telehealth or are you full?
It's a good question. So I practice in Washington State. I currently only have a Washington State license. So what that means is you must be, and the bullshit of the world, right? Like, do you think healthcare is any different in North Carolina than Washington State? No. But state regulations, don't blame the doctors for this, is what I'm saying. State regulations say that the person has to be in the state where the doctor is licensed, which makes, again, arcane state rules. But I'm already booked out for months and months and months taking care of Washingtonians. So I'm like, I have no incentive to get other state licenses because I'm like, I got 9 million people in this state. 50% of them are female, right?
Yeah.
But so the point is I take care of Washington State people or people who fly in right now. I have no problem with you flying in. But
I'm flying in. I'm going to get on your book.
No, to me, I'm like, you're in Boulder. You have resources. I will get you the people.
Yeah. Okay.
What about
We'll hook you up with
Park
Dr.
City?
Carolyn Franziak. You will say you know me. I will help with her taking care of you. We will get all the women, all the Bulkamid in Boulder in Colorado, and we'll help all the people.
Done and done. All right. So your Instagram, is that the best place for people to get a hold of you or follow you?
So either in Instagram, because I love it, but it gets a little busy on there, So you can always send me an email, info@kellycaspersonmd.com. That's through my website, which is kellykaspersonmd.com. My baby of babies is the podcast, You Are Not Broken. I love it. That's the long form, right? Because you have to hear these things a couple of times to understand hormones and the pelvis and how it works. So I love podcasting is my favorite thing. So You're Not Broken. And then the book is being re-released September 10th. So it's for pre-sale on Amazon right now. If you didn't get the book before, it's now taken down and re-releasing September 10th, which is You Are Not Broken. Stop shoulding all over your sex life.
Okay. We're coming back on in September when you're slammed.
Exactly.
I have 9 million. Everyone has 9 million Instagram lives. Oh, I'm already pre-booking.
Yes,
So
we want to pre-book you now
because this is amazing, and we're making everyone buy the book. I'm going to buy the pre-sale right now on Amazon because I just think you're fabulous, and we are so grateful for your time and for everything that you're doing to serve women. So thank you so much for that, and we look forward to your book launch.
Yeah, thank you so much.
Thank you guys so much for having me.
Thanks for listening, everyone.
If you enjoyed this episode, please consider giving us a 5-star rating and sharing the Body Pod with your friends.
Until next time.